Bismillahirrahmanirrahim. Assalamu alaikum dear students. Today we are going to start a new chapter, the nervous regulation of circulation and the rapid control of arterial pressure. This chapter is going to be divided into two parts, the nervous regulation of circulation, and the second part is going to be, in the second part we are going to discuss the rapid control of blood pressure or arterial pressure. As I mentioned in the previous chapter, as we discussed in detail, that the local blood flow is controlled by the tissues themselves. They decide how much amount of blood is going to come to them depending upon their requirement for oxygen and nutrients. But now we are going to discuss the generalized control of blood flow all over the body, the amount of blood that is going to flow to different organs, not cells or tissues, but whole organs. This is going to be decided, or this is going to be controlled by the nervous system, which is actually the autonomic nervous system, which controls this part of circulation. It is not only it is going to affect the blood vessels, it is also going to affect the heart and increase or decrease the heart rate and the contractility according to the need. So, let us now begin with the nervous regulation of circulation. So, as I mentioned before that your circulation is controlled by autonomic nervous system. It is a part of your nervous system which is not within your conscious control. As you know, the part which is in your conscious control is related to the cortex of your brain. You know the cortex which has the sulci and gyri. It is here where all the conscious functions of your body are planned and take place, which are under your control. But the functions which are not under your control are in fact they are rather automatic, such as your breathing, your heart rate and the contractility of the smooth muscles of your blood vessels and different organs. These are under the control of the autonomic nervous system. So, the autonomic nervous system is not present within the cortex, it is present in the brain stem, which is actually the midbrain, the pons and the medulla. And this autonomic nervous system is mainly divided into two parts, the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is your fight and flight nervous system, which is associated with stress, any stressful condition, whereas your parasympathetic nervous system is your rest and digest nervous system. So, the signals or the impulses through the sympathetic nervous system are distributed to the organs or reach the organs through sympathetic spinal nerves, whereas your parasympathetic nervous system distributes its impulses or signals mostly through the vagus nerve. So, this is just a revision of the autonomic nervous system. Here you can see an organization. You must remember that your sympathetic and parasympathetic nerves arise from different segments. Your sympathetic nerves arise from your thoracolumbar segment of the spinal cord, thoracolumbar segment, and here you can see there is a chain of sympathetic ganglia which is present outside your vertebral column in the region of the thoracic and lumbar segments. So, when your sympathetic nerves arise from these segments of the spinal cord, they exit the vertebral column and they relay in a chain of ganglia which is known as the sympathetic chain of ganglia. And your parasympathetic fibers arise from the craniosacral segments of your spinal cord. These are your parasympathetic segments, and these are the cranial segments and the sacral segments. So, to revise again, your sympathetic fibers arise from the thoracolumbar segment of your spinal cord, while your parasympathetic fibers arise from craniosacral segments. And you can see that these sympathetic nerves which arise from the thoracolumbar region, they come out of the vertebral column and they relay with the sympathetic ganglia. After relaying with the sympathetic ganglia, they merge with the spinal nerves and they distribute to the organs, to their target organs such as heart, blood vessels and smooth muscles of different organs and vessels. While your parasympathetic fibers, they arise from the craniosacral region and mostly from the cranial region. When they emerge from the spinal cord, they travel to their organs through vagus nerve. As you know, vagus nerve is one of the biggest cranial nerves which travels throughout your body. That is the reason it is called vagus, as in vagabond. Vagabond are the people who are gypsies, who do not stay in one place but travel all over the world or all over the country, as you can say. So this nerve, vagus nerve, when it emerges from the cranial part of the spinal cord, it is not restricted to one part of the body like other cranial nerves. In fact, it enters the thorax and abdomen and it supplies different organs there. So it is the most important or major parasympathetic nerve. So one thing that you need to remember is that the sympathetic nervous system has more extensive nerve supply to the blood vessels as compared to the heart. यानी कि sympathetic fibers blood vessels को ज़्यादा innervate करते हैं और heart के पास कम जाते हैं. On the other hand, the parasympathetic nervous system has very little supply for the blood vessels. It majorly or mostly supplies the heart. So heart has more parasympathetic nerve supply, whereas blood vessels have more sympathetic nerve supply. So with this knowledge, let us begin and discuss the sympathetic nervous system first. So the sympathetic nervous system innervates the blood vessels and the heart, but as I mentioned before, the nerve supply to the blood vessels is much greater as compared to the heart. And among blood vessels, it supplies small arteries, arterioles and veins. It does not supply the capillaries. Capillaries have no sympathetic nerve supply. So there are two types of nerve fibers, which are vasoconstrictor fibers and vasodilator fibers. So many of you students make this mistake. Whenever you think of sympathetic nervous system and fight and flight, you always think that there is only going to be vasoconstriction, but you are wrong. Always remember that during the fight and flight condition, most organs of your body do experience vasoconstriction, but there are some special organs in your body which require vasodilation to cope with the stress. For example, let's take an example of the sympathetic nervous system, which is the fight and flight nervous system. Suppose you're strolling through a park or through your street at night, and suddenly you see a dog behind you and this dog starts following you. Now you need to run and to save your life, and now your sympathetic nervous system is activated. So you now bring to your mind which organs are necessary and to help you run in this situation. Of course, your skeletal muscles. So the skeletal muscles, the blood vessels in your skeletal muscles will dilate to give them ample blood so they can work hard and help you run out of danger. And also the smooth muscles in your respiratory tract will dilate, and your coronary vessels, the vessels which are present within your heart, a portion of these coronary vessels is also going to dilate, and the blood vessels in your brain are going to dilate. So these special or important organs which are very essential in the fight and flight condition experience vasodilation On the other hand, those organs which are not important in this situation, like your skin or your bladder or your GIT or your spleen or liver or other organs which are not important in this situation when you need to outrun a dog, are all going to experience vasoconstriction. So the blood can be diverted from these non-essential organs towards essential organs like your muscles and your heart and your brain and your lungs. Do you understand? So sympathetic nervous system causes vasoconstriction as well as vasodilation. You have to remember that. So it depends upon the organ कि वहाँ पर vasoconstriction होगी या vasodilation होगी. All the important essential stress organs will experience vasodilation, while other non-essential organs will experience vasoconstriction. Now what does this depend on कि where there would be vasodilation or and where there is going to be vasoconstriction? So it depends upon receptors, different receptors. So there are sympathetic receptors alpha 1, alpha 2, beta 1 and beta 2. So here we are concerned with the receptors, especially the alpha 1 receptors, which are present in the skin and in the these are present in the smooth vessels of your bladder, of your GIT, etc. Also we have to consider your B1 and B2. B1 are receptors which are present on heart, and what we need to do now, we need to cause vasoconstriction on the receptors alpha 1 and we need to cause dilation at the receptors of beta 2. Now there are two types of transmitters or hormones which play a special role in the sympathetic nervous system. One is the norepinephrine and one is the epinephrine. Remember, at the end of sympathetic nerves there is more secretion or of norepinephrine and very little secretion of epinephrine. You have to remember this, that at the end of all sympathetic nerves there is secretion of norepinephrine. But as you know that in case of sympathetic stimulation, adrenal glands are also activated which are present on your kidney. These adrenal glands secrete greater quantities of epinephrine as compared to the norepinephrine. This is just some background knowledge which you must remember. It is not only going to help you in physiology but also in pharmacology and in medicine. So you must remember this. So what is more important is that the alpha 1 receptors are more responsive to norepinephrine. Alpha 1 receptors are more responsive to norepinephrine. So as a rule you can say that norepinephrine acts on alpha 1 receptors which are present in the non-essential organs and causes constriction. Okay, and the beta 1 and beta 2 receptors, they respond more frequently to epinephrine. So you can say that epinephrine acts on the beta receptors and it causes vasodilation. So this is something you need to remember. We are going to revise this again on the next slide, but this was just some background that you need to know. And now let us get into the details. So here is our greater detail of what I just told you now. Here, so alpha 1 receptors are present in the smooth muscles of all blood vessels within the body except skeletal muscles and the heart, and they are also present within the skin and within the sphincters. And these alpha 1 receptors are more sensitive to norepinephrine, and when norepinephrine acts on these alpha 1 receptors, it causes vasoconstriction. Okay. Then we have the beta 2 receptors. They are present in the skeletal muscles. As I already told you that the smooth muscle of the blood vessels of the skeletal muscles need to relax and dilate during fight and flight conditions. Okay. Why? Because you need to outrun a dog or any predator, and for that you need a large blood supply to your skeletal muscles. So the beta 2 receptors which are present within the blood vessels of the skeletal muscles are more responsive to epinephrine as compared to norepinephrine, and when epinephrine acts on beta 2 receptors, it causes vasodilation. So here is the breakdown of what I told you before, and you must remember this, and you must not forget that both vasoconstriction and vasodilation take place when sympathetic stimulation happens, and it depends upon the areas where there is going to be constriction and where there is going to be dilation. It also depends upon the receptors and the neurotransmitter. So alpha 1 receptor is present in skin and the blood vessels of your GIT and sphincters, etc., which are not required during stress conditions, and these alpha 1 receptors respond to norepinephrine, and when norepinephrine acts on these receptors, it causes vasoconstriction. So blood can be diverted to more important organs like the skeletal muscles, and on the skeletal muscle blood vessels there are present receptors beta 2 which respond to epinephrine, which causes vasodilation in this area. So I hope you understood this very important point. Also you must remember that the vasoconstriction which occurs within the blood vessels of non-essential organs causes increased blood flow to the blood vessels of essential organs. In this figure you can see that the blood vessels have great supply of sympathetic vasoconstrictor fibers. ये उन blood vessels की बात हो रही है which are present elsewhere in the body, not within the skeletal muscles. So the non-essential blood vessels within the body have sympathetic vasoconstrictor fibers. These fibers are more in number on the on the veins as compared to the arteries, because by squeezing the veins more blood can be diverted towards the essential organs. Now let us discuss the parasympathetic nervous system, and as I mentioned before that the parasympathetic nervous system has little nerve supply to the blood vessels. However, it has extensive nervous supply to the heart. So the parasympathetic nerve fibers, they go to the heart through the vagus nerve, as I already mentioned that it is the main parasympathetic nerve. What it does, it when it supplies the SA node, it slows down the heart rate, and this is its major effect on the heart, while when it has very little effect on the blood vessels. The minute nerve supply which does actually supply the blood vessels causes mild vasodilation within the vessels. And the neurotransmitter which is excreted or secreted at the end of the parasympathetic nerve fibers is acetylcholine. The area within the brain which controls the nervous system, the circulatory system, is known as the cardiovascular area, cardiovascular area or cardiovascular center, CV center. In your book in Guyton, it is mentioned as the vasomotor center, but a more appropriate name would be the cardiovascular center, because in this center there are present neurons to control the activity of the heart and as well as the blood vessels. So cardiovascular control system would be a much appropriate name, but in your book the name vasomotor center is mentioned, which is also used in many books and many instances. It is a general name for all the group of neurons which are present in this area, both associated with the control of heart rate and the control of blood vessel diameter. So, regarding this these neurons, you must remember this, that this figure which I have shown here is just a schematic figure. What it shows is the actual sensory area which detects changes in the periphery and sends these in this information to the neurons to decide whether to cause vasoconstriction or vasodilation, or to speed up the heart or to stop the heart. So, this sensory area or sensory group of neurons is known as the nucleus of tractus solitarius, nucleus of tractus solitarius, NTS. So, as you move forward, there is another group of neurons which is associated with the diameter of the blood vessels. This is known as the vasomotor area. Vasomotor area. In this vasomotor area, there are two types of neurons, one which cause vasodilation and one which cause vasoconstriction. As you move forward, there is another area, group of neurons which is associated with the activity of the heart. It is divided into two groups, the cardiac acceleratory area which speeds up the heart, and the cardiac inhibitory area which slows down the heart. These areas are present in different regions of the brainstem. Some are present in the pons, some are present in the upper part of the medulla, some are present in the lower part of the medulla. So, you cannot see all of them in one section of the spinal cord, but I have shown this figure. This is a supposed or schematic figure, not an actual figure, to show you all these neurons in one segment, which is not actually possible. Okay, so remember this. This is just a schematic diagram, not an actual diagram, because you cannot visualize all of these neurons in one section as they are present in various sections in the longitudinal order. So, let me tell you again. First of all, there is a sensory area which is the nucleus of tractus solitarius. Then we have an area which is associated with the diameter of the blood vessels, and it is known as the vasomotor area, and in the vasomotor area there is a group of neurons which causes vasodilation, and there is a group of neurons which causes vasoconstriction. Then as you move forward, there is an area which is associated with the activity of the heart, and it is divided into two group of neurons. One group of neurons is associated with the acceleration of heart and is known as the cardiac acceleratory area, and the other group of neurons is associated with slowing of heart. It is known as the cardiac inhibitory area. These areas are more are discussed in more detail in a book called Sherwood. You can look at it for reference, and it is not very clear in Guyton. So, you can check it out in Sherwood if you need to, but this is the gist of it, and this is the main concept of these areas. So, this nucleus of tractus solitarius, which acts as the sensory area, it receives information from the periphery like your baroreceptors or your chemoreceptors, which we are going to study in detail once we move on to the other part of the chapter. These nerves, the 9th and 10th nerves, vagus nerve and the glossopharyngeal nerve, they bring the information from the periphery to the nucleus of tractus solitarius. Now, this nucleus of tractus solitarius is going to judge the situation. Suppose some person had an accident and experience a great blood loss, and the baroreceptors within his large arteries indicate that there is a sudden fall of blood pressure. Now, to raise this blood pressure, what are the changes that are going to take place within the blood vessels and within the heart? This is going to be decided by the information coming to the nucleus of Tractor solitarius. So, the initial condition was that there is decreased blood pressure and decreased blood flow through the large arteries. Nucleus Tractor solitarius is going to understand this, and it is going to send signals to the vasomotor area. Now we need to raise the blood pressure. What are we going to do? We are going to cause vasoconstriction throughout the body. So blood pressure can be raised to a level which is necessary to maintain life or to save the person's life. So the vasoconstrictor area is going to be activated, and the vasodilator area is going to be inhibited, so the vessels can constrict and the BP can be raised. Signals are also going to be sent to the area which is concerned with the activity of the heart. So if you need to raise the BP, what are you going to do? You're going to increase the heart rate and increase the contractility of the heart. So what the nucleus of Tractor solitarius is going to do, it is going to activate the cardio-acceleratory area, and it is going to inhibit the cardiac inhibitory area. So the cardiac acceleratory area is going to send signals to the SA node and increase the heart rate, and the cardiac acceleratory area is going to send signals to the vasculature of the heart or ventricular muscles and increase the constriction of the heart. So this is the basic concept of how the nucleus of Tractor solitarius and this vasomotor center and the cardiac center work together, and how they control the blood pressure and the diameter of the blood vessels. We are going to discuss this in detail in the second part of this chapter, the arterial regulation. So discussing the vasomotor center in detail, as I mentioned before, there is one sensory area which is made up of nucleus of Tractor solitarius. We have a vasoconstrictor area, we have a vasodilator area, we have a cardiac inhibitory area, and a cardiac acceleratory area. So let us discuss these one by one. The sensory area is present in the posterolateral medulla, and you have to remember this for the MCQ. What does this mean? Posterolateral medulla. Suppose if this is a section of medulla, I don't know if this is anatomically correct, but you must bear with me for the reason of understanding. Suppose this is the anterior side of medulla and this is the posterior side of medulla. So it is present on the posterolateral sides of medulla, posterolateral medulla. So it is also present bilaterally. You have to remember that all of these areas are present bilaterally, both on the left side and on the right side. So the nucleus of Tractor solitarius is present posterolaterally in medulla, and it receives its input through the 9th and 10th nerve, which is the glossopharyngeal nerve and the vagus nerve. The output signals or control the activity of the vasodilator area and the vasoconstrictor area, also the cardiac acceleratory or cardiac inhibitory area. Secondly, we have the vasoconstrictor area. It is present in the upper part of the medulla, and it sends sympathetic fibers to maintain vasoconstrictor tone. Acha, what is vasoconstrictor tone? At all times, all your arteries are in a state of semi-contraction. They're not just flabby or loose, they are slightly constricted. This slight constriction of blood vessels at all the time in your body is known as vasoconstrictor tone. This is the basic tone or basic mild constriction of all your blood vessels at all the times within your body. So it is this area, the vasoconstrictor area, which is responsible for this tone or mild constriction of all your arteries in your body at all the time. And this is the area which sends the continuous signals to these blood vessels. और जब ज़्यादा कंस्ट्रिक्शन करानी हो, such as in case of vasoconstriction during the sympathetic activation, then the signals through this area increase to cause more constriction of blood vessels according to the need. Then we have the vasodilator area, which is present in the lower part of the medulla, and the fibers from here inhibit basically the fibers from here inhibit the vasoconstrictor area to cause vasodilation. As I mentioned before, that the blood vessels do not have parasympathetic nerve supply, so vasodilation cannot occur here. So how does vasodilation occur in blood vessels? It occurs through the inhibition of vasoconstrictor fibers. Do you understand? Suppose this is a blood vessel. As I mentioned, it has mostly sympathetic nerve supply and no parasympathetic nerve supply. This sympathetic nerve supply can cause vasoconstriction of these blood vessels. But what if you want to dilate these blood vessels and there is no parasympathetic nerve supply? So what you do is you cause the inhibition of these constrictor fibers, and this is done by the vasodilator area. And norepinephrine is released at the end of these fibers, which cause the vasodilation. Then we have the cardiac acceleratory area. It is present more laterally, and it causes contraction of the heart, and it also increases the heart rate of the SA node. Then we have the cardiac inhibitory area. It is present medially, and it decreases the heart rate of by sending parasympathetic fibers through vagus nerve. Okay, and also remember that parasympathetic fibers are not very abundant in the ventricular muscle, so the cardiac inhibitory area cannot actually greatly reduce the contraction of the heart. It can only reduce the heart rate, while the cardiac acceleratory area can increase both heart rate and the contraction of the ventricular muscle. And this entire vasomotor center, which is present in the brainstem, is controlled by higher centers such as the reticular substance, the thalamus, the hypothalamus, and also the cerebral cortex. Let me tell you how cerebral cortex plays slight role in the control of your circulatory system. Before that, you must remember that other higher centers such as the reticular formation, which is present in your midbrain, pons, and medulla, is responsible for controlling your vasomotor center. So is thalamus and hypothalamus. Hypothalamus तो बहुत important है. Why? Because it is the hypothalamus which has neurons which basically control your autonomic nervous system. Hypothalamus is the center of control of your autonomic nervous system. So what might confuse you is how is the cerebral cortex involved, while cerebral cortex, as I mentioned before, is the seat of consciousness. It is only associated with conscious control of different functions. So how can your cerebral cortex be involved in the control of your of your circulatory system? Let us discuss that now. So you might be aware of a phenomena known as the vasovagal syncope. You might have seen several times within movies, cartoons, and also in real life that whenever a person hears a very shocking news or very emotionally disturbing news, they suddenly collapse and faint. And if you read some old Victorian novels or some Jane Austen novels, it was very common for in women to faint after hearing mildly distressing news. So this is known as vasovagal syncope. Now, how does that happen? If the cerebral cortex receives any disturbing news or any disturbing thought, as I mentioned before, cerebral cortex is where all your thoughts are generated. So if you think of something very emotionally disturbing, or if you hear something very emotionally disturbing, your cerebral cortex is activated. It sends signals to your anterior hypothalamus. So this anterior hypothalamus has neurons which are associated with the parasympathetic nervous system, and the vasodilator area is activated. And when the vasodilator area and the cardiac inhibitory area are activated because of the activation of anterior hypothalamus, suddenly there is vasodilation all over the body, and your heart rate and heart contractility becomes slow, and your arterial pressure falls, and there is not enough pressure generated in your body to pump the blood to your brain, which is the reason the blood flow to brain suddenly decreases, and the person collapses or falls down and faints. So this is known as vasovagal syncope. Let me revise it for you, that whenever you hear a disturbing news, or you generate a disturbing thought within your cerebral cortex, signals are sent to the anterior hypothalamus, which causes the activation of vasodilator area and the cardiac inhibitory area within your vasomotor centers, which causes a sudden decrease in blood pressure, and the blood flow to your brain decreases, and the person suddenly collapse. This is known as the vasovagal syncope.